human health is our most important resource, our most valuable asset as individuals and as a society.
Amen.
So, to convince you that I'm qualified to speak with you today about this important topic, I brought along, let's see if I can get her to come up here. Well, it's not that important, actually. There we go. All right. See if we can get to the next slide.
Aim higher.
There we go. I brought along Clarabelle Sheehan. Clarabelle is no longer with us, but I thought to convince you that I was an expert in this topic and try to be able to break it down, that you would trust the country doctor, right? So I have to convince you that I'm a country doctor and that I'm an expert country doctor. So to convince you first that I'm a country doctor, I just want to introduce you to Clarabelle. Clarabelle was one of my first patients, and that's her common law husband, Roy. Yes, Clarabelle traveled in the snow to make it to her appointment. And as I was unwrapping the cotton sock from around her thumb, I said, Clara, what have you done to your thumb? You're a diabetic. This could be serious. And she replied, God loves a kid, but I do love the whole guy. I can't help it, I do love the whole guy. I said, what were you doing? She said, I had a whole head down there until I touched that eyeball out and said, right in my hand. Well, you see, my grandfather lived in Prosperity, and we used to butcher hogs, and my granddaddy would say, we eat everything but squeal. I've never had an eyeball. But I hope that convinces you that I'm a country doctor. Secondly, my dad taught me something as a native of Prosperity. I'm a Columbia native, Keenan High graduate. And I improved on it a little bit, and this should really convince you that I'm a country doctor, and that is hand motion. So now I have to convince you I'm an expert, and I'm after all giving a TEDx talk. And I'm fixing Dr. Salady as a man. Actually, as a Southern man, I think I'm fixing to fix healthcare. And it's got an X in it. But what is wrong with healthcare? Peter Orszag, the Congressional Budget Director, when looking at the trajectory of healthcare spending in America, said that in order to address healthcare, we have to address cost, quality, and access. Cost. We spend $2.6 trillion on healthcare in America. That's roughly equal to the GDP of China. So when we're worried about the Chinese economy eating our lunch, we don't have to look too much further than healthcare and say, why is it that we spend $8,000 per capita in America? And when the book was published this month from the Institute of Medicine, comparing our health care to 16 other similar affluent economies, we spend $8,000 per capita, and the other cultures are spending $3,000 per capita, and we are number 17 out of 17 nations in infant mortality, longevity, chronic disease, diabetes, and heart disease. How can it be that we tolerate the fact that 60% of all personal bankruptcies in America were caused by healthcare expenses in 2009? 60% of personal bankruptcies. But you know, if we were spending all this money and we were really getting something in return, it would be wonderful, because we would have the best health care in the world, but we don't. There's a huge quality gap. We have the highest infant mortality.
We have longer lifespans, we have shorter lifespans. And in fact, when they adjusted for taking out everyone other than the non-Hispanic whites, we fared poorer and had shorter lifespans than the other comparator nations. In fact, recent immigrants to the United States fared better than native-born Americans. And the last point was access. As you can see here in this slide, we do have a universal access system. Universal access to the emergency room. And look at the cost in the ER in 2008, $900. In 2009, $1,300. But we don't have universal access to primary care. In fact, a primary care doctor's visit isn't the problem. It's only on average about $70 a visit in 2010. But only a third of our practicing physicians are primary care physicians. And thankfully, women are coming to the rescue. 1 in 5 Americans lack a primary care provider. We will need 21,000 primary care physicians by 2015. We don't have the pipeline to produce it. So there are a lot of misconceptions about healthcare. And I bring this graph to show you that, as you have heard, our population is upside down. We have more people who are old and fewer people who are young in order to build a better healthcare system and finance it. But the misconception is that the problem is actually not the number of beneficiaries. It's the explosion in cost per beneficiary. And this was pointed out in a Dartmouth study looking at the cost of life in major academic medical centers for the last 6 months of a person's life. And it showed that at UCLA, the costs were basically twice that at the Mayo Clinic. But at the Mayo Clinic, the quality scores were actually higher, despite the lower costs. And when they teased out the data, they found there were more primary care physicians compared to specialist physicians in the Mayo Clinic model. So if we look at the federal budget, we can see that in 1965, when Medicare and Medicaid were developed, it was 1% of our federal spending. By 86, it was 10%. By 2006, it was 19%. That $2.6 trillion that I spoke of that we spend on healthcare, interestingly, is 19% of our GDP. And in the federal budget, it's reflected as well that Medicare and Medicaid is now 19% of federal spending. So, to convince you that we can fix healthcare, I want to show you what I call prosperity slides. Prosperity for our state, our nation, and yes, I believe, our world. Let's look at South Carolina Medicaid. In 1998, there were 400,000 patients on Medicaid. That's about 25% of all children. 40% of all deliveries were covered by Medicaid. By 2007, there were about 1 million people on Medicaid, and 40% of children were covered on Medicaid, and about 60% of all deliveries. When I ran against Mark Sanford after chairing his healthcare task force, I used to love to go to Republican gatherings and point this out and then say, but you know, the mother and baby part of Medicaid is only about 20% of the state Medicaid budget. And if you have an elderly loved one in a nursing home, 2/3 of all patients in the nursing homes in South Carolina are covered by Medicaid. So there are a lot of things here that we need to understand, but the bottom line is we have to address cost, quality, and access. So in 1993, I was asked by Governor Campbell's Secretary of Health and Human Services, Gwen Power, to help develop a better way to deliver care for Medicaid recipients. And what we came up with was the PEP plan. And as you can see in this graph, although everyone said you can't keep Medicaid patients out of the emergency room, when this program was piloted in our practice in 1996, it led to a precipitous drop in not only hospital ER charges, but also physician ER charges. And at the end of the year of piloting this program in our little rural prosperity practice, Gwen Power called me up and said, the program in your demonstration site has saved Medicaid $1 million in a year. Simply by giving patients a medical home and telling them these are appropriate reasons to go to the ER and these are inappropriate reasons to go to the ER, this is when you should call us first. How many of you have ever gotten a letter like that from your doctor? So, I also want to share with you some information that also came out of prosperity, so I say it's a prosperity slide. And this graph depicts, as you can see here, the broken red line is Newberry County infant mortality, the red line is Newberry Hospital's infant mortality, and the blue line above is South Carolina's infant mortality, and the broken green line is the United States. Well, what happened right here was our county's only OBGYN died. And by 1992, our little rural family practice had been trained to do C-sections. And we were the only providers of obstetrical care from 1992 to 1997. And as you can see, infant mortality at our county hospital went to 0. Now this broken red line are people who got pregnant in Newberry and went somewhere else, possibly. This is what happened in our county. But more powerful than that is this point. As you can see, the broken purple line is Newberry County Black and other infant mortality, and the broken orange line is white infant mortality. Black infant mortality across our nation is twice that of white infant mortality, but not in Newberry County in this time. Black infant mortality actually fell below white infant mortality because of a primary care medical home. So in order to fix health care, we have to address these 5 issues: access, cost, quality, and disparities, all of which will be most effectively addressed by giving patients a primary care medical home. When Bill Pittard, the MUSC researcher, looked at the data of the PEP program in comparison to health maintenance organizations who like to tout themselves as medical homes, the HMO programs cost $3,000 more for care for the first 2 years of life when compared to children that were in the PEP program. And school readiness scores were even higher in those patients that had a primary care medical home. But there's one other issue that I haven't mentioned, and that is that, well, I guess I'll just go ahead and say in disparities, I hope you've been convinced that a primary care medical home will address disparities, because when a person is treated by their local primary care physician, they're not going to be treated any differently because they're the janitor at the school or they're the principal. We're all part of a community. The one I haven't touched on yet, though, is personal responsibility. And this is important to discuss because only public policy will effectively address personal responsibility. There's some of you who are in the audience that I've been very involved with in helping to raise our cigarette tax. By increasing the cigarette tax in South Carolina, which had not been increased since 1977. Finally, after 30 years, we were able to get an increase in the cigarette tax to 50 cents. But that's a place where public policy makes so much sense, because for every 10% increase in the cigarette tax, there is a 7% decrease in youth initiation and 90% of people who smoke start smoking for teens. And there's a 3% decrease in adult use. I mean, how many smokers do you know that are adults wish their children were smokers? And there are other public policy issues. In fact, 40% of all deaths in America are related to alcohol, tobacco, physical exercise, and diet. In this study, the one thing we excelled at the most was consuming the most calories. And probably the most compelling point that I read is that when they looked at 23 countries, 80% of the firearm-related deaths were in the U.S. of A. 80% of the firearm-related deaths were in America. Together, we will fix healthcare through primary care medical homes and public policy that promotes better living, better communities, and global competitiveness. Thank you very much.